Welcome to the Healthcare IT Today CIO Podcast. I'm John Lynn, the founder and chief editor at Healthcare IT Today. I'm excited to bring you the most practical healthcare CIO insights and perspectives. We know your job is challenging. We want to help you be more successful. And this episode of the CIO Podcast is brought to you by HCTec. HCTec partners with healthcare CIOs and leaders to transform IT from a cost center into a strategic lever, optimizing workforce models, simplifying operations, and improving financial performance. Yeah, something that we all would appreciate. So if you want to learn more, be sure to check it out. HCTec, that's TEC.com. And our guest today is Todd Richardson. He's a former CIO at multiple organizations. Welcome, Todd.
Hey, thanks, John. Glad to be here.
Yeah, you have quite the depth of experience across multiple organizations. I'm excited to learn from you. But for those that don't know you, tell us a little bit about yourself and your experience as CIO.
All right, thanks. Been a CIO for the last 22 years. Been with 5 major health systems around the country. Kind of did the almost like 5 years at a time in my last organization before I retired 2.5 years ago. I spent about 12 years there. Started early in the 90s with a little software healthcare company, and just kind of worked my way up. And one day I found myself being a CIO. Started back in 2004, I think, when I started in the CIO ranks, and then your career just kind of morphs, and then pretty soon you're retired and you look back on your career and a lot of experience, for good or for bad. You learn a lot of stuff, and probably learn as much through the mistakes as you've made as through the things that you've done well. So now, as I'm retired, looking to do some consulting and taking advantage of a great industry that's given so much back to me, and or given so much to me, and the opportunity to give back, and working with some consulting companies and smaller health systems. So I'm glad to join you today to provide some insights, good or bad. I guess the users can decide, pick from it what you will, and discard that doesn't work for you.
Yeah, well, I love that you have experience across multiple organizations and even doing some fractional CIO work lately, which I think is,
Right.
that provides some really interesting perspectives. As I look at the market today, like health systems are under like real margin pressure right now. How is that changing what's expected of IT?
It seems like for the first part of my career, we were, given the challenge to get systems in place with the, electronic health records starting to come into their own, and the mandates that, we really had to push to get a lot of technology into a field that didn't have it for so long. We were chasing, banking, manufacturing, insurance companies. Those folks were well out ahead of us. So our first part of our career was really trying to get an unknown. You sit around the C-suite, and everybody understands operations, you understand the finance, you understand the HR, but we were the new guy at the table. So really trying to find our place at the table and getting our colleagues used to technology, and in the more recent years, the technology's there. We've got electronic health records in place, and now it's mergers and acquisitions, and the challenges. It's really about lowering the cost of healthcare, driving value. We heard for so many years that, oh, we're going to put this technology in that's going to help us drive down the cost of care. I don't know that it really ever has. There's all kinds of factors that go into it, but we do drive efficiencies, and every time you drive costs down in one area, it seems like it comes up in the other. But labor is a big piece of our world. And so how do we drive value through the organization, drive productivity, do more with less or more with the same? So I think it's really, if I were to look at my world today and this as a CIO, it's driving that value and taking a look at the overall cost of IT. And we spend a lot. What we find in our budgets is it's not really our stuff. Our systems are our user systems. So they say drive the cost down. Which systems would you like me to shut off? So there really is very little we can look at that is not required. And so I found using benchmarks and showing where we are as a percentage of net revenue as just that percentage. And so I talk to my CFOs, don't tell me to try to go cut a bunch of cost out. Look at me as a percentage of net revenue. What is healthy? What is a good industry standard? And let's shoot for that. Because labor, as I mentioned, is probably 50% of my cost in my IT budget. Then you got software contracts. So how do we rationalize that? But again, I think benchmarking is a good place, and then get that conversation off the table, and then look at how we drive value through the operational units.
Yeah. It's fascinating to think about that whole evolution because everyone was chasing stimulus money or avoiding the penalties, right?
Right,
Whichever, or both, right? In most
right,
cases. And so there wasn't this whole cost rationalization. It's like, wait, no, we have to do this or we're going to
right,
have
right.
penalties that are going to be really problematic. And, hey, we get some incentive to do it too. So it's interesting how that's totally changed how we think about it, right? Now
Right.
versus then. So, like health systems, when I look at them, like they often look at IT as a financial burden instead of a lever for efficiency, probably due to the stimulus money. I'd love to hear your thoughts. And how does a CIO need to kind of reframe this in this new world where the stimulus money isn't flowing, the penalties aren't driving demand the way that they were during the EHR days?
Well, it's interesting, and anytime costs start to get out of control or finances become an issue, and you're two sides of the coin. You try to drive revenue, so you're working on driving revenue as an organization because you never cut your way to success, is words I heard a long time ago. But then there is a cost, an expense side of the equation. And then when you double click on a health system and you open it up, where do you go? You go to a place where there's money. So it's the old saying, why do you rob banks? Because that's where the money is. If you're going to look at cutting costs, you're going to go to a place with a lot of dollars, thinking if I can get a percent, if I get 1% out of anybody's budget, where am I going to get the most? It's IT, because that's where the biggest budget is. Before I retired, we had 17 hospitals, and my budget in IT was larger than 16 of the 17 hospitals, and that's how big it was. So I think you've got to own the narrative as the CIO when you know the targets on you, because there's so many numbers. Having a good governance structure in place so you're completely transparent and they understand where the dollars are. And then I've tried to have the conversation to flip it from, don't see me as a cost center, see me as your 401k. If you're going to invest, right, for the future and drive, where are you going to do with your money, John? You're going to put it in the bank, or are you going to put it in a 401k and try to drive value? You're going to try to invest your money where you're going to get the biggest return. Are you going to get the biggest return in dietary? What about supply chain? What about IT? If I can drive that efficiencies through IT, so flip that narrative and think of it as your 401k. Then the question is, do you want me in the 25th percentile, or do you want me in the 75th percentile? So as you start benchmarking and you try to get productivity, it's always about driving down to get to the 25th percentile, being efficient. Yeah, that's a good conversation in areas that are driving productivity. But IT is not driving that productivity in that sense. We don't make widgets. I can't say, how do I make 17 widgets instead of 15 widgets in a given hour? So you want to drive that and have systems, and invest in systems that are driving productivity. How do you create an ROI for XYZ project? And if you can't make the business case, why are you doing it? So again, I think flipping that narrative and saying, I'm your 401k, invest in my cost center. Don't cut me, and let me help then drive the value for other areas in nursing and supply chain and rev cycle, and let that be the narrative that we try to push.
Yeah. It's interesting because you talk about IT efficiency. Like, I think that's an interesting concept that more organizations probably should embrace. But where do you see health systems kind of wasting the most effort or money when it comes to efficiency and the efficient use of IT? And you pointed out labor is typically the largest component of your IT spend. So talk about why it's one of the hardest things to manage well.
And I mentioned earlier, we don't make widgets. Most of the IT department is filled with professional employees um, that are exempt by nature. So you're not paying an hourly wage. When you're just, let's just take a nursing area, because it's an easy concept. When you're paying an hourly wage for a nurse and you're having overtime and you're having extra hours and it's a cost per hour, that is a different conversation. You drive productivity differently there. You want to make sure on a given use, that you've got it, the nursing standards based on how many patients they can take care of. And it's a very tight thing to manage for productivity. So you're always managing productivity, and you have a numerator and a denominator, and you can always do the math and you know where you're at. You try to avoid overtime. When you're dealing with IT, you're dealing with exempt employees that are making good professional wages. They're professionals. And so then they're exempt. So they're paid to get the job done. They work more than 40 hours a week. The work we do is on nights and weekends. Many of our upgrades are extra hours in preparation. So when we start talking about productivity, and we do, every organization talks about driving productivity. It's a hard conversation to have in IT because, again, we don't. There's outcome to our work, but it's not this measurable. I saw 4 patients today, or in the emergency department, we ran 150 patients through, or I got so much driven out of my in basket with the revenue out of our AR days. It's a different conversation, so it is hard, and I think we spend a lot as organizations on project approvals, and how do we really focus on this asset that is IT, and those hours that are very limited. You only have so many hours that we have to throw at projects. And so how do we really focus as a health system on making sure that resource is being leveraged and spent on the highest value work? And I think it's a hard concept because an organization will see IT as, okay, you got 250 people. They do some quick math and they figure they got this many hours to work with, and they really don't. Most organizations, I can tell you, every organization I've been at, we've been built to run. We've been built in size to run the systems we have. We're not built to grow. We're not really built for some of that transformative things. When you do a major acquisition, you're not built for that. You're built to take care of the systems you own and do some normal daily upkeep on those systems and smaller projects around it. So if you're going to take and acquire someone, that's a massive amount of work. You don't have those resources. So and again, kind of back to the question, how do we leverage that percentage of hours we have available for net new stuff? And I think that's where we spend, because everybody wants their own thing. But as an organization, how do we really look at it strategically and say, which projects fit to our strategic plan are going to drive the value for us as an organization? So I think that is certainly one of the challenges around managing the IT resources and making sure we're as productive as we can be, because we can't just sit on the bench and wait for you to get the planning done. Every day that goes by, we lose hours, and we're not going to get those back.
Yeah. Where do you see, I mean, do you see a mismatch between IT labor and the value it produces, in organizations that you've worked with?
I think we do a poor job of measuring it. We know I've got so much labor and I know what it's going to cost me. So I have part of the equation. The question is what value it drives, and how many projects over my career have I seen that, oh, I've got to have this. It's the silver bullet, and this is going to help me drive productivity, and it's going to help me with X, Y, Z. And they get the funding to get it, but there is perhaps not a formal ROI done. There's no pro forma really done to say, here's the cost and here's the value. And even when we do that, there typically isn't a show back where I got to come back in a year and show that I actually your make good. You got to do a make good. And so I think organizations that have a very tight intake process, they tie the spend to the return and then do a make good. So the operational person that said they wanted this, make it up, automated computer assisted coding. I'm going to get this software. I'm going to drive out all this labor. Did you really do it? So I think it is having discipline, and it's always easy. It's not easy. It's easier to get the approval because it's a bright, shiny thing and it sounds glitzy and you get the approval to do it. That's easier than then putting together the make good to come back and show that you actually invested those dollars well. And then then it's easier to get money. If you're successful at doing that and showing you drove the labor out, then you come and ask for money again. It's easier to get that on the operational side.
Yeah. Well, and there's so many things that IT does that maybe there's not a make good. If you acquire 3 hospitals, like how do you even evaluate the make good of integrating their systems with yours, right? I mean, I guess you
Right.
could show reduced costs of software and consolidation, app rationalization. But anyway, it's definitely a challenge, that's for
It
sure.
is. It is.
Interesting. The other part of labor that I think is fascinating, and we had Bill Grana from HCTec on to talk about this, and I'd love to hear your perspectives as well. How should CIOs be thinking about the right balance between full-time staff, full-time IT staff versus contractors versus external partners, like HCTec that provide a service? Like, how do you approach kind of those three buckets of labor?
Right. And I mentioned earlier, I've always been and I've always seen myself as built to run. And maybe that's the wrong way to look at it, but I think that's
Is that how you
when
were funded?
exactly, that's really kind of how you're funded. You're funded to run. And so when you end up with your funding, that's what you have. You have your folks. And it's always been a number, every organization, every CIO I've talked to, it's kind of 70-30. You have 70% of your people's time in general, painting with a broad brush, that is spent on the daily care and feeding of the systems you own. Then you got 30% for net new transformational fun projects, growth if you have it, those kinds of things. So if you look at that 70-30, then you're 70, right? Then you start cutting that down. Okay, what about my administrative going to meetings and how much is upgrades? And so you really do, look at it that way. And so fundamentally, if you think of yourself as built to run, then where does the external labor you need? Those are for a couple of things. If you're in an acquisition mode and you're bringing on multiple hospitals or clinics, that's growth. Target that and let you know. It's also a philosophical thing of whether you want to capitalize it or run it through an OpEx.
Sure.
If I'm going to bring in an acquisition and I'm going to go spend, I don't know, $25 million bringing in a couple hospitals, do I want to capitalize that and depreciate it over time? In which case, if you bring in your contract labor, you will typically capitalize a lot of that. If you do it internally, you can still capitalize some of your stuff, but then it becomes a philosophical conversation with the CFO. How do we want to do it? If we just grab our folks and put them on it, do you want to run through CapEx or OpEx? That's your organization's discussion. If you take those contract labor then and you throw them at the daily care and feeding while you got your people off doing it, that you're going to capitalize it, the contractors you're going to run through your OpEx. So that's going to hit you on your operational expense. So part of it becomes a philosophical thing and a financial discussion you have with your CFO on what the organization's policy or theory is on it. But I would always use my contract labor, try to, for those big net new things. If you bring in another module of Epic, you send your folks off to get certified and you get them ready, but they've never done it before. And they're going to struggle and you're going to get the theoretical side of how to do it through your Epic folks. But my experience would tell me, you want to make sure you got somebody that's done it, been there, done that, got the t-shirt, that's got experience, practically speaking, that's worked in a hospital, in a GI unit, that can tell you the real side of how it runs and make sure your build is appropriate. If you just go, Epic's got some really good people. And a lot of them they're really bright. They're very good. And a lot of them don't have a lot of experience working in a hospital. And so they've got the theoretical, here's how it's supposed to work. Well, here's how it really works. I think of Rodney Dangerfield when he went back to school and he goes, that's not the way you do it. And so he talks about it. Here's how you do it. You pay off the city commissioner and so that's kind of the pragmatic versus the practical, or the theoretical versus the pragmatic side of getting systems in. And so you spend your dollars on that external labor for those projects that are projects. They got a beginning, they've got an end. You bring in these guns for hire with good knowledge, and they're able to help you get your systems in, and do the knowledge transfer to your folks so that you can ingest them and then do the daily care and feeding, take those on and run them. I think the other place, I've tried to learn to be very thoughtful about it, is how do you use external labor to take on things that aren't strategic? Some of the things in your portfolio that just are, either an area like the help desk, is an area where it's not strategic. It's got to get done. It's very important. You're the front door to your IT shop because when there are problems, that's where they call. It's a high turnover area. Anybody who's good in your help desk, you steal them. You promote them to be application analysts, or they move into being an engineer. So you're always rating your help desk staff, because anybody who's good there is going to move up very quickly. And so constant turnover. But yet you want a good face to your department with good folks, but you're constantly turning it over and you're shooting yourself in the foot. So how do you take a look at the service desk and look at that saying, does it make sense for us to outsource that to an organization that can do it at scale? They can ramp up, they can pay different salaries to folks that like to do it and do it at scale with multiple organizations. Take something off of your team that tends to not be the most glamorous work. It's an entry-level job, but it's not strategic. So how do you look at that? Or areas like that. And so you carve that labor out as kind of a purchase service, contract labor. Everybody calls it something different. I see it more of a purchase service. Outsourced my service desk once. And when I had the conversation with the entire help desk team, we went to a little local pub and I announced to them that we were going to outsource the service desk and nobody was going to lose their job. And in fact, everybody got a promotion because we made sure that everybody on that team had a spot to land in the organization. It takes time. It takes 9 months, a year to do that. And so through that period, everybody's resume came out. We knew who we had. We handpicked some people and said, we need you here to help us with the outsourcing. I need you to help get rid of your job because you're the expert. They helped us with it, and they were the first people. So any manager who was going to hire somebody, they had to go through the service desk team first, and they got the first shots at the jobs. So in a lot of cases, they already had their next job locked in, and they stayed at the service desk to help us with that transition. And then they moved off into those positions once we got rid of it. And then today they're managers, directors. They've moved up. So we didn't lose a single person. And it's a good way to do it, but it's a tough conversation to get a piece of your organization that you think you can get out of just that normal labor. And hopefully that answered it with kind of the contract labor and the non-strategic side.
No, for sure. And I think the service desk is an interesting place because it's not strategic until the doctor can't get an answer to their question. And then it becomes very strategic, right? The other one I see with a lot of organizations, and, as I've talked to a lot of different companies doing service desk, is that many people can't find the expertise to provide the service desk, or that person leaves, or like you said, they get promoted. And now you're like, wait, now I don't have the expertise I need in the service desk. So I see a lot of people contracting that out to other companies to be able to solve the problem because they just can't get the expertise in to be able to service those needs. And then it makes a lot of sense to work with an external partner who can, tap in across the country to quality individuals, or maybe they have it so they have shared resources across multiple organizations. I think that's interesting as well.
Yeah, and it does depend. And again, this becomes a philosophical conversation that's not right or wrong. And it depends on the side, where the organization's at. When we came through COVID with remote workforce, when we sent everybody home, we let Pandora out of the box. When we started sending people home and realizing we could, our vendor partners, the Lawsons, the Oracles, those folks that have big sales teams all over the world, they've operated forever with remote workforce. In IT, you haven't. You've been on site in Wausau, Wisconsin, and that's where you lived and that's where you worked. And we didn't embrace, a mobile workforce. And so that has changed considerably. The war on talent, if you will. I'm losing people in Wausau, Wisconsin, who are now working for somebody on the East or West Coast because they can. And that has really changed it. We've had the conversations with health systems about, we are on the West Coast and I've got somebody in the Midwest. Do I pay them the same as I pay my West Coast folks when their cost of living is, in a rural town in the middle of Wisconsin? How do you justify that on one standpoint? But yet then how do you flip it and say, how do I pay these people that are doing exactly the same thing just because they live in two different places, two different salaries? And I'm fully convinced there's not a right answer. There's how people choose to do it. And then that affects your balance of folks. So certainly a different world than 10 years ago.
Certainly influences how you recruit people too. I've had that same challenge as well. It's like, it's tough to pay that premium, when you don't need to. How about simplification? I see a lot of CIOs focused on that and trying to simplify their environment to be able to reduce both the IT costs, but also the labor that's required to service all of those. How do you approach simplification?
Um, Standards to making sure you're looking at the um, things that you do in terms of your PCs, in terms of your application. We start talking about application rationalization. How do you begin looking at that and standardizing? Um, just had a conversation here in the last several months on devices, and we've had people start, they want Macs, they want PCs, they want what they want, and they got what they got, and they were able to get anything they wanted, and we were then turning to needing to actually support all that. And it does cost you more when you have to have an Apple team and a PC team. That's doubling your complexity. It can lead to issues downstream in terms of things that will or will not work. Now you've got updates that have to happen that are very different. And how do you start to standardize that? I'm working on a computer today. I mean, I have not worked on an IBM DOS based computer since 2009. I've been a Mac guy all my life. Always had it Mac. Everything I own's a Mac. Went out to do an interim job, and I was going to take the standard. We got in there and says, we need to make Macs go away. They gave me a computer. I'm like, well, I'm going to have to learn how to use this. So it's certainly a learning for me, but I felt like, if I was going to drive that, I kind of had to eat my own dog food and say, I can't tell people we're going to take their Macs off their desk when I'm walking around with a MacBook. So I can tell you, I'm still trying to figure things out, but that does help to drive some of that down. The other piece, I think, in driving some of those standards, and it's easy to say, and every consultant comes in and says, oh, we're going to do application rationalization. That sounds like a great thing. Like, we got $35 million in app spend, so we should be able to decompress those and get rid of them. And it sounds good. It's certainly harder to do. We've allowed people to go out and get their niche systems for years. Now we're trying to pull those back in. And now the functionality, within some of your major platforms, like let's take Epic, let's take Infor, let's take Workday, SAP. Now they've got the functionality to replace these little niche systems built in. So now we can move to it. But man, the cost of change is difficult. They're used to using it for good or for bad. They've optimized poor workflows in their departments, and now you're going to try to change them off of one and move it into, let's just say, Workday or Infor, and it's change, and change is difficult, and so there's a cost to change. Then you're dealing with the data and how are you going to archive it, so you've got that cost. At the end of the day, I don't know if we save a lot of money, because now you have to pay licensing fees. Let's just say Infor versus XYZ company, you have to pay licensing fees either way. Sometimes it's going to be more, but it's on a platform. Now you have one less thing that's sitting out there that requires another application analyst that can know that application and their upgrade versus your upgrade. And so there's smaller things. I think if you were to start a brand new health system today, and you could go in and take a platform approach to say, here's my EMR, here's my ERP, and you built out all the functionality that it had and said, if we need it, it's going to be that functionality. Man, I could like to almost be like to be a CIO in that organization and not inherit 384 applications that are all just dyed in the wool. We're going to use this till we die. And trying to get rid of them is hard. But trying to simplify, that's where you really try to start. And again, it sounds great, and it's really hard to do. Or you're in contracts, so you got 5 years left on your contract, and they're not going to let you out. So now you've just got to eat it. You're trying to create a plan, and you just look at your contracts and say, when can I possibly get out of this? And then it's death by 1,000 paper cuts, trying to always migrate stuff out.
Yeah, and when you acquire different hospitals, you're doubling the challenge as well, especially with the culture of what they like.
Yeah, the technical debt you acquire, that's in applications, it's in hardware, it's in getting them, to your network standards, getting folks to your all the tools that you've got, and you want those tools to simplify your environment, and you can run good stuff. If you simplify and only run one, but if you got multiples, try to try to manage an environment just at a network level with multiple network technologies. And now you got different tools to manage, different sets of skills. So it's simplification is certainly one of those big words we go after, and it's hard to do.
Yeah. I'm still pondering your comments about kind of being funded towards operational as opposed to kind of the more ambitious enterprise strategy that would probably be a more interesting, possibly even more effective. But I'd love to hear, like, what does it look like when IT is truly aligned to your enterprise strategy, to the overall organizational strategy, rather than just reacting to the demand of the moment that's needed. How do you kind of evolve from that, keep the lights on, maybe I'll describe it that way, versus kind
Yep.
of, hey, it's an enterprise strategy. We want to really execute as a strategic differentiator in your organization.
Well, when I say I'm built to run, it's usually the frontline staffing is kind of where you're at. While you're built to run, you should absolutely be part of the bigger picture and the strategy. And
Mm-hmm.
I always like the phrase, it's not easy, but it's simple. It's not, it should be more simplistic thinking. I, I always have stepped back in my career, and anything, something like feels like I'm putting myself into a knot and a little pretzel kind of thing. I've made it too complex. We got to step back and simplify the work. So when I think of the annual planning cycle for an organization, and every organization has their own, I always try to simplify it in my mind and say it's 1 year. Let's just break it down to be 1 year, and that's your budget season. We know how to budget. We begin the budget, we plan, we start our budget on, let's say July 1st, and we end on June 30th. So let's think of the world as July to June. Then you start backing into that funding year to say, okay, what leads to that? Leading into the budget year typically is a strategic planning cycle where you're really taking back a look at your organization, saying, what's our mission, vision, values? What are we going to be doing for the next 3 to 5 years? And you start laying that out on the operational side, whether it's growth in a service line, growth in acquisition, retooling, bringing on something different in your organization. You always have that strategic planning activity that typically is laid out on a calendar sometime in advance of the budget process. So budget processes take a long time, just because they do. Capital and OpEx, it takes months to get that ready and buttoned down to go to the board. But so before that, you have strategic planning. In the organization I was at before I retired, I was fortunate that the timing of the way we laid things out, we always started our budgeting like beginning in January. We did our strategic planning before that. I would take my senior executive team, and we would go down. We would let UGM. So we were an Epic shop. So we would, UGM, their annual conference is August, September timeline. So UGM would come out. You'd have all the new bells and whistles that they would announce. And so they had all the upcoming development for the year has been announced. We would then, after that, we had our strategic planning effort. So we knew as an organization where we were going strategically. Then I would instigate a session. It was a visioning session that we would take the entire, and fortunate being in Wisconsin, we were 2 hours from Verona. So we'd pack up the entire senior executive team and our key VPs over certain areas, and we would go down to Epic and spend the entire day. Carl, Judy, the entire team of Epic folks would come in. We would go through our strategic planning session and talk about where we're going as a health system. They would go through, okay, here's the new things with Epic. Here's what we've done in the coming year. And our deliverable out of that session was always a roadmap for what we were going to be doing the next year. Whether it was an acquisition that we needed to bring in, whether it was one of the newer modules we were going to decide to bring on. But that always led into, and you had the VP of Rev Cycle and the CFO and the VPs of your clinics and your specialty clinics and ambulatory care and acute care, and everybody there, marketing. And we laid out the plan on a whiteboard with them to say what makes sense, with our strategic partner at the table helping us, knowing what we were going to do. And then we'd come back, and that would feed right into budget season. So I wasn't having an argument about what module of Epic needed to go into the budget. It was just a deliverable that got lifted and shifted right into our budget. When we
Right.
did zero-based budgeting, so we knew what we had for the last year. We had our net new projects, and it was slick, but that was what it felt like to really be embedded with my operational colleagues. So they learned more about our roadmap, where we were. We knew right where operations was going to be. Clearly, your IT team is involved in that strategic planning session. I sit through our strategic planning session thinking, okay, what's going to take IT? What's going to take IT? And everything does, right? Everything takes it, even if it's just even if it's growing a service line, you're and more of the same. You still got to build out those clinics. You still got to build out those departments. You still got to implement hardware and technology, and you got to have circuits dropped in. And so, we would sit and always just be kind of on our little notepads, making sure that we understood what was going to be required of us. And then it was completely transparent. Here's what it's going to take on the IT side. So, and then they embraced us to say, okay, we're going to do this. We got to have our IT partners at the table. So it felt like a very good dance. We want to do this. What's the art of the possible? And I was just having a conversation with somebody the other day. It is dancing, and somebody's got to be leading, right? It's a man and a woman dancing. The guy tends to lead. Doesn't mean you necessarily can do it on your own, but that's
No.
operations. Operations, you have to lead this. And you're going to need your partner there to be the other side, but you got to take the lead in it. And so I'm not going to leave you on the dance floor by yourself. But I want to make sure you understand we go out there, you're going to be leading, and I'm going to be arm in arm with you, and we're going to be doing it together. And so we succeed or fail together. And so I think it is a dance
Yeah.
that does take you both. And gosh, you can never point fingers. You always have to say what do you need from me, and what is it going to, and what's it going to take, and involve me early so I don't get surprised.
Yeah, that's such a great analogy. As someone who loves dancing and
Ugh.
definitely leads in the dance floor. But it's true, like I can lead as good as I want, but if the partner's not supportive, if they're not interacting with that leading, if
Yep.
they're not providing their skills and talents, then it just doesn't go well and no one enjoys it. So that's a really incredible analogy. I love that.
Yeah.
I'm gonna have to use that one.
Yeah. It's free to use.
Well, as we wrap up, we always like to end with a little bit of career discussion, career advice. I'd love to hear, what would you say is maybe the best piece of advice you've been given in your career?
Oh, that's a great question. I think if you look at your career and your philosophies and the things you take on and kind of your approaches to it, I think one of the most, and I don't know where I got it, and it's probably morphed over time in a book I read relatively recently. And one of my biggest pet peeves as a CIO and just as a human is seeing areas where people are victims, and they see themselves as the victim. And it's easy to do in IT, where somebody doesn't bring you in early and you get surprised at something, and then it's the blame game, and it's like, oh, they didn't, it's always operations fault and all that. And so really choosing never ever to be the victim. And so when something goes wrong, and it's easy to blame others, or blame another department or a user, I mean, you could name it, any area, um, resisting that temptation to blame, and always taking the accountability to it, to say, okay, if I missed, something happens and I didn't get pulled in, what could I have done differently?
Right.
Rather than ever blaming the person or the department. Well, maybe I should have been more engaged with radiology, and I should have been meeting with them more often and making sure I knew where they were going and making sure I was out ahead of them, so I could have been at the table when these discussions occurred, so they didn't go select a PAC system and sign a contract without my knowledge. And so some of it you have to go to an nth degree to go, okay, it really wasn't practical, they probably was their fault. But avoiding that thinking,
Mm,
because when you have that thinking, it sets you and your operational partner up to just beat heads,
yeah.
or be at odds with each other when you do need to be dancing and being supportive. You can't have a fight with your wife and then go off to the ballroom and expect to have a great dance. It's just, there's going to be tension. You're going to go through the motions, but there will be tension. So how do you really engage with operations at all sides? Not saying, well, I'm just the IT guy. How do you know your business, own your business, be a part of your business, embed with your partners to where you're always ahead of them, or certainly not behind them, maybe with them. So you're always aware of it to avoid that then I become the victim and I act like a victim and I sound like a victim, and nobody likes that. And we've all seen folks who do it. I can tell you it's hard. Something happens, you get that visceral taste in your mouth. It's like, oh, here it is again, and you got to stop. And when I taste that taste, I stop and I step back and I'm like, okay, I screwed this one up. How did I get myself here? And I think that's
reframing it.
It's totally reframing it, right? Ask different questions, get different answers. It's reframing it, because it's not, I've learned it's just not about being right or wrong. And I might be right today, but I'm going to win the battle and lose the war. Yeah. So you're better to just eat the crow and say, how could I have done this differently? And then try to educate them and help them along, and not create barriers that are going to be barriers forever. And you get a reputation, right? You get the reputation as the guy that people want to work with, or you walk into the room and suck all the life out of it, and you don't want to be that person. So how do you position yourself as a senior executive with your colleagues and let them know they've always got your support? And I think avoiding that blaming is probably a key thing. It's hard to do.
Yeah. Todd, I think that's good advice for hospital leaders, but also for life. So
absolutely.
I think that's something we can.
It works at home too.
I'll definitely be leveraging that one. So thanks so much, Todd, for taking time to talk with us. We appreciate you being on this episode of the CIO podcast. And we also definitely want to give a shout out and a thanks to our sponsor, HCTec, for sponsoring this episode of the CIO podcast. If you're not familiar with HCTec, they help healthcare organizations optimize their IT labor strategy and improve the operational efficiency. So be sure to check them out at HCTec. It's HCTEC.com. Thanks so much, Todd. And thanks everyone for watching and listening. If you want to find more great healthcare IT content like this, be sure to check it out in their favorite podcasting application. Just search for the CIO Podcast by Healthcare IT Today. Thanks so much, Todd.
Thanks so much. Appreciate it.